So we know the physical benefits of exercise, such as on fitness and reducing the risk of certain long-term health conditions. What is talked about less is the positive impacts that exercise can have on our mental health and our brain function. As physiotherapists, improving physical function to help people recover from pain or other conditions, whether physical or mental, is a big part of what we do. So in today's video, I'm going to go deeper into how to use exercise and physical activity to improve our mental well-being, our cognitive function, as well as assisting in opioid reduction. Hey friends, welcome back to the channel. If you're new here, my name's Mahin and I'm an advanced physiotherapist specialising in pain management based in the UK. On this channel we explore lifestyle strategies and tools to help people create healthier and happier lives. Today I'm going to be talking about how we can use exercise to improve our mental well-being and brain function. So let's get into it. So most of the exercise guidelines out there are actually focused around physical health promotion. So the guidelines in America that talk about 5 hours of exercise a week, or the World Health Organization that say 75 minutes of high intensity exercise or 150 minutes of moderate intensity exercise. But actually there aren't many guidelines showing the benefit of exercise on our mental health, or how much exercise we need to do in the week to get those mental health benefits. And it's actually a lot less exercise is needed to get a positive benefit on our mental health than we need for our physical health. Often what can stop us from exercising though is the fear and anxiety around that. So often if we have a fear and anxiety around exercise, the anxiety around the actual exercise can be a barrier to actually improving anxiety through exercise, which can be a bit of a catch-22 situation. So what's really important to have a look at if we are looking at exercise from a mental health perspective is starting off with something small and building that consistency up over time. Because there's nothing worse than thinking about exercise as this big daunting thing that, has to be done in the gym or has to be a run or anything like that, that we may not be particularly interested in. Because when we look at exercise in that way, it can be quite overwhelming and it can increase the anxiety around exercise, which often then stops us from exercising. Some is better than none when it comes to exercise, of course, and that sounds obvious. But often what we try to do is we set ourselves really high targets for the week. So let's say that, for me personally, I have done this before where I've said I want to go to the gym 4 times a week. But actually in reality, I'm maybe going to the gym once a week. So it's a big jump and a big ask to be going to 4 times a week, especially with busy schedules and everything like that. So by saying, some is better than none, just trying to do that next bit of activity. And it doesn't have to be formal things I've mentioned in previous videos before. Exercise is movement and it can be anything that we can incorporate into our daily lives. The best form of exercise is the form that we don't know we're doing. And that's because it's so entwined in our daily life that actually we don't have to think about exercising. Think about back to childhood and think back to our ancestors. In childhood, we never thought, I haven't done enough exercise because we're playing, we're doing sports, we're at school, we're running around the playground. We don't have to think about exercise. Same with our ancestors. They were hunters and gatherers, so they would go out and they would have physical activity as part of their daily routine. Now with desk jobs, we have it less, so it's finding a way that we can incorporate general movement and activity into our lives. And consistency is then key with this, and consistency over intensity. So doing little and often is often more sustainable in the long term than trying to have significant parts of intensive exercise throughout the week. So there's now an overwhelming amount of evidence for the benefits of exercise on anxiety and depression, and even on some conditions such as ADHD and PTSD. And exercise is being used more and more for the treatment of mental health conditions. And we can all take some stuff from this because we don't have to have a mental health condition to struggle with mental health from time to time. So I know for myself, I've noticed in periods where I've been particularly busy with work and I've maybe skipped exercise a little bit because unfortunately, when I tend to get busy with work, exercise becomes less frequent for me, which I'm trying to embed it into my daily routine or my week better. But during those periods where I'm exercising less, I notice a significant, increase in anxiety and stress. Nothing to the point where, I have an official diagnosis of anything like that. But we can all feel anxious from time to time. And it's important to think about actually how active are we during those times, because there might be a bit of a link there. And exercise is a really, really good way of helping with those feelings of anxiety, and particularly during stressful periods. The other thing that I've noticed is that when I'm not exercising as much, I have reduced focus. So I might actually be in the middle of a really busy period where I need my focus the most, but because I'm not exercising, my focus is diminished. That then means that I take a little bit longer to do the work that I need to do, which then eats up into my time to exercise. So that's a bit of a vicious circle there. Reduce focus, less time to exercise, which then leads to reduced focus even more, and that cycle continues. And there is actually some research out there now that shows that exercise is equal to or even better than anti-anxiety medications or treatments for depression. And physical activity can be really helpful in the treatment of conditions such as anxiety and depression, because there's a lot of similar physical sensations that crop up. So when we are exercising, we get increased heart rate, shortness of breath, sweating, symptoms that are very similar to when we are feeling highly anxious or maybe even having a panic attack. So exposing people to these sensations through exercise can actually be really helpful in managing these feelings of anxiety throughout the day. So whether that's before a big presentation at work, or if they're in an uncomfortable social situation, they may be getting some of those similar sensations. And if they've been exposed to it through exercise, they can manage those sensations a lot better. So then the question is, should exercise be the first treatment for mild to moderate anxiety and depression ahead of medication? Well, when we actually look at medication, antidepressants don't actually work for a third of people due to individual variability, but also drug-resistant depression. So often medication isn't helpful for depression, and exercise may be more useful. And lifestyle changes, focusing on diet, exercise, and sleep, could quickly become the gold standard treatment for anxiety and depression, because we often see quicker changes with lifestyle changes than we do for some treatments like CBT. And for all of these reasons that I've just mentioned, physiotherapists and PTs are becoming more of the norm in mental health units and in the treatment of conditions like anxiety, depression, but even conditions like PTSD, ADHD, as I've mentioned. One study compared the genetic risk for dementia versus physical inactivity and found that physical inactivity increases the risk of developing dementia just as much as genetic. Another study compared interval walking, and interval walking is where you intermittently increase the pace of the walk, so to the point that it is difficult to maintain a conversation. So that's kind of otherwise known as high intensity exercise sometimes. So a study compared interval walking to normal walking and stretching in older adults. And it found that interval walking significantly increased memory performance for older adults who were otherwise sedentary compared to normal walking or stretching alone. And this is because the increased intensity and bursts of activity produces more lactate in the muscles, which leads to more growth factors and neuroplasticity in the brain. And this helps support the growth and function of brain cells, in particular in the hippocampus, which is the key region for memory function and is the key culprit for Alzheimer's disease. For older adults who are particularly concerned about developing dementia, a recent systematic review showed that resistance training is particularly important for improving cognitive function. And this is all really important because there are no medications for dementia. So there are things that we can do to help prevent dementia or delay the onset of it, but actually once we develop dementia, it's very difficult to treat through medication. So this is where exercise can be really used well for the prevention, but then also when people do have dementia, it can improve their memory performance then as well. So of course, exercise can be used a lot in prevention of developing long-term conditions, and also children that are more physically active are less likely to experiment with drugs. The other thing is that children that are more physically active are more likely to be active later on in life and are less likely to develop painful conditions, which may lead to the initiation of opioid treatments. Exercise can also speed up the process of recovery from opioid addiction as it releases dopamine and endorphins, which can stimulate the reward system. When we become addicted to drugs, there is too much dopamine in the brain to maintain homeostasis. The brain then, quite cleverly actually, removes dopamine receptors from the reward system. So if the drug can't bind to these receptors, then it can't stimulate pleasure. The problem is that you now need a supernatural amount of dopamine to stimulate the reward system and feel good. So this is where natural pleasures like eating or sex no longer give the brain pleasure. So when you take away those high levels of drugs, then the body can't feel the same amount of pleasure that it did when it was on the drug or even before that drug addiction began. This is also similar for opioids, as an excess of this drug leads to a reduction in central opioid receptor availability and therefore less potential to modulate pain through opioidergic mechanisms. When exercise and movement is used in the recovery from drug addiction, it can help to build up the level of dopamine receptors available. And this can crush drug craving really well, so this is why it's used in the treatment for drug addiction. And it was actually found that a single bout of 30-minute exercise, whether that was cycling, walking, or running, actually crushed drug cravings for 30 minutes afterwards. So exercise helps to open back up those reward channels so you start to feel good again. And this is why exercise is being used more and more as a treatment in rehab facilities to reduce the likelihood of someone relapsing again. Specifically to opioids, when we exercise, the contraction of skeletal muscle increases the discharge of mechanosensitive afferents, which activate central descending opioid pain pathways. These pathways have receptors throughout the peripheral and central nervous system that produce our body's natural opioids called endorphins. These endorphins bind to opioid receptors and provide a short-term pain relief during and after exercise, and that's why it can be really useful to be used during opioid reductions. And this is just another reason why physical activity is promoted when you are weaning off opioids. For more ways to improve mood, sleep, cognitive function and focus, check out this custom playlist that has my best lifestyle ways to improve your health and happiness. For more information on how opioids are used in persistent or chronic pain, check out this next video here. Thanks for watching, take care, and I'll see you next week.